Here you see the case of a unicompartimental degeneration. While the outer joint space is wide and completely intact, due to a bowed leg, like a varus malalignment, the medial aspect of the joint is degenerated. It's a bone-on-bone situation. And if you see in the MRI, the cartilage is gone, the bone shows edema, means it's injured, the meniscus is destroyed and pressed out of the joint. In these cases, I prefer to do a unicompartimental replacement instead of a total knee. Why? The regeneration is much faster. The cruciate ligaments remain. I only address the problem. It's not as painful as a total knee. The in-house stay is around 4 till 5 nights, and after 2 weeks, people can mostly walk without crutches.